Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Fertility is not just a hormone problem, it is a signal integration problem. That is, there is some kind of a signal error which results in infertility or pregnancy failure. In clinical practice, many individuals and couples present with infertility despite having hormone values that fall within normal laboratory ranges: FSH, LH, AMH, thyroid function, and prolactin. This often leads to confusion and frustration. The reason is simple but poorly understood. Fertility is not determined by individual hormonal levels alone. It depends on how multiple biological signals are integrated across the system. So, limitations of hormone-centric view is what we need to understand. If we only look at the hormones, there is some problem. There are some limits. Let's try to understand those. Hormones are frequently tested as isolated entities. However, hormones function as signals, not as independent drivers. A normal hormone value does not guarantee that the signal is released at the correct time, or that the target tissue is responsive, or that the downstream response is appropriate. Reproductive success requires coordination, not just adequacy. That is, it just does not mean that the hormonal levels should be normal. So what does it mean? What does signal integration or correct signaling mean in fertility? Fertility is regulated through continuous communication between multiple systems. The hypothalamic pituitary ovarian axis. So from the brain, the pituitary releases signals to the ovary. That's very important. The uterine endometrium communication. The immune system is important. Metabolic and vascular pathways are important. Autonomic and stress response systems are also important. For conception to occur, ovulation must be synchronized with endometrial receptivity. Immune tolerance must allow embryo implantation, and blood flow must support placental development. Not just this, the brain must interpret the environment as physiologically safe. This is called signal integration. What is signal failure then? What are the clinical examples? Let's see. In daily practice, we see patients with normal ovarian reserve but poor egg competence. So good quality embryos with repeated implantation failure can happen. Regular menstrual cycles but unexplained infertility can occur. These cases often involve disrupted signaling due to chronic stress and elevated cortisol. Low-grade inflammation could be a reason. Insulin resistance or metabolic dysfunction could be a cause too. Impaired uterine blood flow could also result in implantation failure. The hormonal signal exists, but it is not effectively received or processed. This is the problem in such situations. Now, what are the implications of such a problem for treatment? Adding or adjusting hormones alone cannot correct a dysfunctional signaling network. Effective fertility treatment requires restoring the timing of the hormones, improving tissue responsiveness, reducing inflammatory and stress-related interference, and supporting systemic balance. This is why individualized system-based fertility care is essential. When fertility does not occur in spite of normal test results, it does not mean the body has failed. It often means that the biological communication required for reproduction is faulty. Fertility is not a single hormone issue. It is a complex signal integration process, and it must be approached as it is. If you wish to understand more, please feel free to contact us. Thank you.